Imagine a simple blood test could reveal if you're at risk for serious lung or liver disease before symptoms even begin. Alpha-1 antitrypsin testing is a breakthrough that could change the course of your health, especially if you or your family have struggled with unexplained breathing problems or liver issues. Stay tuned to learn how this test works, who needs it, and why it could be the key to protecting your future. Alpha-1 antitrypsin, known as AAT, is a protein made in your liver that plays an essential role in protecting your lungs from inflammation and damage caused by irritants like smoke, pollution, or dust. When your body doesn't produce enough AAT, your lungs and liver become susceptible to serious diseases, including chronic obstructive pulmonary disease, COPD, and cirrhosis. This deficiency, referred to as Alpha-1 Antitrypsin deficiency or AATD, is a genetic disorder, meaning it's inherited from your parents through changes in the SERPINE1 gene. AAT deficiency often runs in families. If you inherit two mutated copies of the SERPINE1 gene, you have AAT deficiency and face a much higher risk of lung or liver disease, often developing health problems before the age of 45. If you have only one mutated gene, you are a carrier. While you may not have symptoms, you still have a slightly higher risk of developing lung disease, especially if you smoke, and you can pass the gene on to your children. The gene mutations that cause AAT deficiency can affect the amount of AAT your liver produces, prevent your liver from making any AAT at all, or alter the shape of the protein so it cannot leave the liver to protect your lungs. Over time, this can result in AAT building up in your liver, leading to liver damage, or leaving your lungs unprotected and vulnerable to disease. Alpha-1 antitrypsin testing is designed to diagnose or rule out AAT deficiency, screen people with a family history of the condition, and guide treatment for lung disease that may be related to a deficiency. There are three main types of testing. First, the AAT blood level test measures the amount of AAT protein in your blood. If your levels are abnormally low, a genetic test, either a genotype or phenotype test, is typically performed to confirm AAT deficiency. The genotype test looks for the most common gene changes linked to the condition, while the phenotype test checks how the AAT protein functions. You might need AAT testing if you have symptoms or conditions that could be caused by AAT deficiency. These symptoms include wheezing, shortness of breath after exercise, a chronic cough with mucus, chest pain, fatigue, a rapid heartbeat when standing, or vision problems. In addition, if you have repeated respiratory infections, asthma that doesn't respond well to typical treatments, unexplained liver disease, or jaundice, your doctor may recommend this test. AAT deficiency also puts you at risk for developing COPD, recurrent bronchitis, paniculitis, a skin condition with painful lumps or patches, and liver diseases like cirrhosis. Babies with AAT deficiency often show signs of liver problems such as jaundice or abnormal liver enzyme levels, and they may need testing as well. For those with a family history of AAT deficiency, unexplained emphysema or cirrhosis, AAT testing can be an important early screening tool. Discovering a deficiency early can empower you to make lifestyle changes, such as quitting smoking, avoiding environmental pollutants, and seeking regular medical care to reduce your risk of severe disease. The testing process itself is straightforward and minimally invasive. For the blood test, a healthcare professional will draw a small sample from your vein or prick your finger. Genetic tests may also use a cheek swab, where a sample of cells is gently collected from inside your cheek. These procedures are quick, simple, and generally cause little discomfort, typically only a brief sting or mild soreness. No special preparation is needed before taking an AAT test. You can eat and drink normally, and there are virtually no risks beyond minor bruising or slight tenderness at the blood draw site. Understanding your AAT status can be life-changing. If you're diagnosed with AAT deficiency, your doctor can recommend steps to protect your lungs and liver, monitor your health more closely, and even guide your family members about their own risk. Since AAT deficiency is genetic, testing can help your relatives decide whether they should get screened as well. Remember, Early detection is the key to preventing serious complications. If you have unexplained breathing problems, chronic cough, unexplained liver issues, or a family history of AAT deficiency, talk to your healthcare provider about Alpha-1 Antitrypsin testing. This simple test could be the first step in safeguarding your health and the health of your loved ones for years to come. If you found this information helpful, don't forget to like this video, share it with friends and family, and subscribe to the MediByte channel. Stay tuned for more great videos on staying informed and healthy.